So Miss Williams here has an order from her physician for placement of a nasopharyngeal airway. She does have pneumonia and has some thick, tenacious secretions that tend to cause some irritation to her nair. So what the physician has ordered is a nasopharyngeal airway, which we are going to go ahead and place with her. But first I'm going to go over it with her just to make sure she knows what's going to happen. Miss Williams, my name is Kaylee Rector. I'm a student respiratory therapist, and due to your thick, tenacious secretions and the irritation that you've developed from frequent suctioning, your physician has ordered for us to put in a nasopharyngeal airway. It's going to be minimally invasive. It's not going to hurt, but it's also going to relieve some of the irritation that you receive from the frequent suctioning, and it's going to allow us to suction without you feeling any discomfort. Okay, so I'm going to go ahead and begin. So an indication for putting this nasopharyngeal airway in is her frequent suctioning. So with us putting this in, you will be able to pass a suction catheter through it without irritating her nasal mucosa, and it's a lot more comfortable for her as well. So first we want to make sure that we size appropriately. So I have 3 different sizes here. So first we're going to take the flange, and you can use the tragus or you can use the earlobe. So I'm going to use the tragus to the nose. This does not reach the tip of the nose, therefore this one is way too short. Right, this next one, flange to the tragus, and it reaches the nose but not quite to the tip of the nose, so this one as well is too short. Okay, to the tragus. So this one goes to the tip of the nose, and when you're measuring from the tragus, you want to give in about 1 inch away from the nose, but if you go to the earlobe, you do not have to account for that 1 inch. So this is the appropriate size. And you want to make sure if you're feeling any type of resistance as you're advancing this to ever so slightly rotate and move your tube around. With this little bevel side here, you want to make sure it's parallel with your septum on insertion, because this little bevel piece can grasp onto some of the mucosal lining and cause irritation, and it can also cause bleeding. It's very uncomfortable for the patient. All right, we're going to go ahead and get started, okay? It will take just a few minutes. So this is going to go in. Going to advance slowly, not forcefully. Feeling for any resistance. Until the flange meets the nair. Just gonna clean this up a little bit. Okay. Now to check to make sure for our placement, we want to make sure that the tip of the flange is at the base of the uvula. Due to our patient being conscious, we don't want to stick a laryngoscope down, so we're going to use a tongue depressor. All right, I'm just going to check for our placement, okay? And it's kind of hard to see, but you can see that it is at the tip of the uvula. All right, and that is how you place the nasopharyngeal airway.